Senator Cassidy, you wanted a second round?
Yes, please. Dr. Bertagnolli, you had said that you had maintained the Biden administration's policy for allowing fetal tissue research, but that it should only be used as a last resort. How could you ensure that fetal tissue is only used as a last resort?
Thank you, Senator. You know, understanding the great sensitivity of many people and passionate feelings of many people on the issue of fetal tissue research, I would want to be very respectful of that. Again, if confirmed as NIH director, my job is to serve everyone, including the communities who care deeply about how that tissue are used. Absolutely, I would follow the laws of the land in every aspect, and I would also follow within the laws of the land. The dictate is we're trying to achieve maximal good for people. We're trying to cure major diseases. That's our highest goal, but we need to do it with respect and obviously follow the law.
Because that slippery slope, we're doing this for an end, and therefore the means are justified. The specific question was, how would you ensure that fetal tissue is only used as a last resort?
Thank you. I would follow our principles of review and oversight over the use of this tissue, which I understand is very stringent and asks that particular question as by the review boards as one aspect of approving its use.
Okay. Now I'm going to ask you some questions related to obesity. My state, unfortunately, is 50th or 49th in terms of obesity. I'm told that the amount of funding directly for obesity, and by the way, we know this, but just for context, obesity is a major driver of health disparities, disproportionately affecting the poor, those of color, but also whites. And it is a major driver of morbidity from heart disease, from cancer, from COVID-19. We know that. I'm told that the funding at NIH that's specific for obesity is only about roughly $1.2 billion a year, or about 2.5% of the budget. Again, but a major driver of health disparities and of morbidity and of all the things that you and I know of. Arguably, funding for obesity is lagging way behind funding for other conditions relative to its impact upon society. How can we better address this issue? Would you commit to increasing funding for obesity? How do we better address the foundational, translational, and implementation of research for obesity?
Thank you, Senator. Thank you very much. I will say that from my current position as the director of the National Cancer Institute, obesity and the rising obesity epidemic is one of the major causes of cancer in the United States. We recognize this. And there's been a tremendous amount of work done by NCI to identify the etiology of this, how obesity drives cancer and how that can be overcome. So I can't speak to the way the funding has been distributed now, but I can assure you that this is yet another one of those topics that does not belong in a silo, for which we've got to work across all of the institutes that can have a piece of owning this problem. And then the last thing I'll say, again, stigma. Making sure that people who suffer from this condition are respectfully included as being part of the solution to the problem.
I accept that. One suggestion, I'm told that nutrition obesity research centers have kind of, a funding which is kind of stagnant. And just to increase that funding would be a place to start. Again, if we're talking about something which is driving cancer, heart disease, hip replacement, you name it, why not? I used to tell my medical students, obesity is here and it has a hydra head. But we seem like we focus more on the manifestations than we do on the creature itself. If we address the creature itself, we address all these. That seems to have been lost. If you could address that, that would be great.
If confirmed, I would be really delighted to work with you on this. I agree that this is a very serious health problem that takes a multifaceted approach, and agree that it is something that we need to work on and would love to work with you on.
Thank you. I yield.